This is a video to look at and evaluate data for Expanse EHR for Citizens Memorial Hospital. You'll see on the acute status board the patients listed here. You can open the patient's chart by clicking on the name. That will open it to the Summary tab in the chart. On the Summary tab, you'll see Bulletin Board. Bulletin Board is an area where providers might list things that they want everyone in the organization to know about this patient before, in the very forefront, so that it's not mistaken. Next down, you can see rounding laboratories. These are listed as LTC rounding labs, but they are really rounding labs for any acute visit, such as emergency department, hospital admission, or the long-term care facility. The labs are listed for the most recent, but you can look at all the WBCs or all of any of these laboratory studies by clicking on the actual result, and it'll show you historically what has been done on this patient. Not only for this visit, but for any visit within our system. Same for all the rest of these laboratories. When you scroll down, you'll see current visit medications. That would be medications given only during this acute visit. So if they got insulin, you could click on insulin and see exactly when they got it by clicking here and then going to MARDOC. You can see exactly when they were given it. Any comments by the nursing staff are listed here, and it's listed in chronologic order. Close this, just click on this, get you back to where you were. Documents are various documents within our system from departments. Long-term care facility, office visits, etc. are listed here. If they would most recent would be listed first, so an emergency department note would be at the very top here. On the right side, you see LTC widgets. These are clinical things like blood pressure, pain scale, you can see down here. Any nursing notes, you can click right into the nurse's notes here and see the nurse's notes for that specific one. Any notes on the same date, or you could look at all notes that were written for this note, for this visit. PT assessments, OT, social services, if they came in and gave a consult, it would be listed right here. You can quickly see vital signs for this visit here, both the initial ones and then the current ones. You can see who their care team is, who takes care of them, who's their primary care doc, who's their cardiologist, their neurologist right here. Scanned documents are listed here. Various other tabs in the chart are also helpful. If you go to Diagnostics tab, it will show you laboratory reports. You can look at imaging studies that were done, and microbiology, etc., all listed right here. Provider notes will show you any provider notes in a chronologic fashion, the most recent at the top. You can click into any of these notes and see the document itself and close it by going here. Home medications are listed here. History and problems here, which shows their active problems, then their past medical history, family history, and social history are listed here. You can then go back to Summary panel and be right back where you started.